we've been doctors and partners for a long, long time. And now we have this passion project. You want to tell them how this all came about?
Yes, I remember so clearly how it happened. I came home one day from work, and then I told her, you know what, Hayden, I keep treating so many patients with scars on their faces, on their bodies, but I think they need more than treatment for just that. I think they need to be treated for their pain in their soul. And you said, let's do something about that.
Correct. I think most people kasi find when they look at scars, they think that it's purely cosmetic, but the truth is it has an emotional impact on people.
Right.
Right? And I just felt that, after 35 years of being Belo and treating so many people,
hundreds of thousands of people.
I just felt that we have the responsibility and also the capability to do something more meaningful to help them. I remember we were having that conversation and I thought maybe our conversation should be out there also. These conversations have to happen about the impact of scars on people, not just for the sake of just understanding them, but also for us to be able to provide empathy, compassion, and even treatment options for them.
And of course, we have to emphasize the role of medical aesthetic doctors in being able to help these people and help them be seen.
Also the healing process, because the healing process for people with scars and their stories.
Yes, that's what you said to me all the time. Scars are stories. What do you mean by that?
I think every scar has a story. It can be a reminder of a traumatic experience. It can be a reminder of some past illnesses,
accidents,
and even wrong decisions.
But also they can be signs of courage.
Because there is a stigma when it comes to scars, right? And because of people's scars, sometimes they feel self-conscious, they feel nawawala yung confidence, and also they're very hesitant to talk about the scars, especially when it's about something that they don't want to tell anyone about. I think Vic's people have to understand the profound impact, the emotions and well-being of people because of these scars. It affects how they see themselves. It affects how they interact with others. And some scars lead people to isolation.
Yes, because scars stay. Not just on the skin, but underneath that scar, they tell me they have shame. Sometimes they have pain and trauma, physical and emotional pain. I've seen it over and over again, especially with the younger people who seem to be more sensitive to these things. And so as doctors, we should look at them holistically and treat them as a whole person.
You've always had a soft spot for people who feel unseen, no? I remember when I first met you, you told me the story of how you started Belo. Why you started Belo?
Well, it really started when I was 5 years old, if you're going to go that way. So, I was always being bullied in school because pinamigay daw ako ng parents ko. Bakit? Napakapangit ko daw. So, parang talagang tumatak sa puso ko, pag pangit ka, pinamimigay ka. And then later on, when the pimples happened and nobody could cure me, I said, okay, I'm gonna have to cure myself. Alam mo naman ako, di ba? I always find an ano. And then, parang when I was already practicing and I was able, I went to the States to study all the new technology, which was not present in the Philippines yet at that time. Mga lasers, all the different lasers that can really actually remove scars. I was getting a little, there were people saying bad things about me.
I remember that.
That, am I a doctor? The lasers can burn your brain, stuff like that. And so I prayed, as I always do. And I said, God, am I doing something wrong? Baka naman I am. Sometimes you don't see kung maling ginagawa mo. And I said, please give me a sign. So initially, may dumating na girl na 19 years old. Napakaganda, napaka-sexy, napakaganda ng skin. I said, what are you doing here? Hindi mo naman ako kailangan. And then she raised her sleeve and she showed me a keloid, a big keloid. So she said that she wanted to enroll in UST, our alma mater. But UST being very conservative, he didn't want her to enroll kasi may tattoo siya. angel on my shoulder na maliit lang daw. So she went to a dermatologist, dermabraid, tapos naging keloid na. So sabi niya, please help me. And I said, alam mo, I have a laser that can remove tattoos with no scar. Sana you came earlier. Sabi niya, kasi I didn't hear about you until nangyari na to. And then I said, see, kasi I stopped there. I stopped talking about what I was doing kasi I felt like every time I came out on TV or magazines or what, the more maraming tao, mga nagagalit na mga medical professionals.
Those stories served as inspiration, especially to me. But there's one more story that, if okay with you, I'd like to share with them.
Oh, ano yun?
That was really, that was really driving me to start this project.
Which is?
The stories that you were telling are it's evidence. And behind every scar, there's a story.
Right.
I don't spend a lot of time on social media, but when I do, I check your page to check on you. And the truth is, it's painful to see people bashing you because of what they don't know about you.
Naku, don't make me cry. Okay.
It's painful to see the stigma, the judgment when they don't know that you battled cancer. They don't know that you had multiple surgeries and all that. And so in their eyes, you're not perfect because your breasts are not symmetrical. You have a scar on your left breast, etc., etc. And people don't know these stories, but
I don't want them to know.
but they keep judging and hurting. But I'm very proud of you because you are strong and you don't care because you know who you are.
I care.
But there are people out there who have similar stories.
You're right.
Stories of either illnesses or, like you said, past abuses, accidents, sometimes heroic acts, and again, sometimes wrong decisions, self-harm. This to me was the impetus para simulan yung Scar Project.
Well,
okay, we have to have these conversations. We have to have an open dialogue. We have to encourage people to talk about their scars and their stories so that the healing can start. And also so that people can learn how to be more compassionate and caring. So it applies not just in the medical field, but for the whole society.
Well, I think the important thing for me is that they can come to a place where they feel seen and we understand them. Especially I can understand them because I've been through the experience, diba? And I think the bonding there is good and the healing begins when they're understood as well.
I always remember when I met you, told me that Belo is it's not about vanity. It's about helping people regain their confidence. And this is the reason why we're doing this project. We're not just trying to erase scars, but we're trying to restore something deeper, something more profound. We're trying to restore confidence. We're trying to restore dignity, and for some people, even hope. And this is the inspiration behind the project. This is not just a set of procedures. We're inviting people to share their journey of healing. We're inviting people to heal. At the end of the day, this project is not about vanity, but about victory.
I agree with you there, Hayden. That's really the heart of the project. But we have been doing this for so many years. What will make the Scar Project different?
Well, what will make this different is that now we're opening the dialogue. We want to raise awareness and foster an open communication, the scars and their stories, so that we can erase the stigma, right? We also want to give them access to treatment options, not just medical options. We're going to provide them counseling, support groups, educational materials, and yes, of course, advanced medical treatments. We also want to educate, everyone about the emotional aspects of scars so that we can provide a more compassionate approach in not just medical settings, but also in social settings. So Vix, what do you want the participants to feel when they become part of this Scar Project?
I hope that they feel free. Free from shame, free from hiding. Sa totoo lang, the transformation does not happen in the clinic. It happens inside when they start to believe that they are worthy.
That's true. So if you're someone with a scar and a story you've never told anyone, then maybe it's time.
Every scar has a story. Let's work together to rewrite a happy ending.